So I'm Sharon Weissman. I'm the Division Chief for Infectious Disease as well as the Program Director for the Infectious Disease Fellowship Program. One of our goals in this fellowship program, in addition to turning our fellows into excellent infectious disease physicians, is to really teach them how to be clinical scholars, in the sense that they take a more scholarly approach to their patient care. They review the literature, they're up on the latest information, and they're really educators not only in their hospital and if they're at a teaching program for their residents and students, but for the whole community. So our program graduates have gone into many different career paths. Several of them have stayed within our program and are now part of our faculty. So they have more of an academic career path, although even in that they've done different things. Some have focused more on HIV, some have focused more on stewardship, some have focused more on bone and joint infections. We've had a couple of fellows who've gone into private practice. I think that's one of the strengths of our program, is how collegial we are, and the fellows, that's one of the things that attracts a lot of fellows to our program. They feel a real sense of camaraderie. We have very good faculty to fellow ratio, and the faculty are all very interested in the fellows and teaching and promoting their academic success as well as their overall well-being. In the clinic, we actually do, it's called IP for interprofessional education, and we do 4 or 5 of these a year, 2-week programs where we have trainees from many disciplines, and they get a 2-week intensive interprofessional training where they spend time with all different aspects of the healthcare, from pharmacy to case management to nursing to social work to the physicians, and really get to understand how the healthcare system works as a team.
I'm Edwin Hayes. I just finished my infectious disease fellowship last year with Prisma Health UofSC School of Medicine, Columbia. When I came here for my interview, I was just amazed by the relationships that the people had with each other. The attendings, the pharmacy staff, the nurses, everyone is just very supportive and cohesive. They do a very good job of working together, and I was very inspired by that. When I came here, though, I was pretty impressed. I didn't expect to find a lot of the populations that I enjoy working with. We have a robust refugee population that our clinic works with, especially as a fellow. We also have a transgender clinic that helps a lot of people in need in this community. And that's really not something you would think about when you think about Columbia, South Carolina, but those populations are here. The need is here, and there's a lot of opportunity to do good. And the more I learned about this area, the more interested I was in working here. Cost of living has greatly improved the quality of life. It's very easy for me to have a smaller amount of money put into day-to-day things and still be able to spend more money doing the things I love, like travel and eat out, and that's been a real boon for me being here. I absolutely wanted a program that had the kind of intimate time and ability to be with me and kind of mentor me directly as possible. But I also still wanted to have access to things like research and kind of that larger academic institution. And this program does a really good job of balancing that. I feel like I get that personal interaction that I'm looking for, but I still have access to these larger academic discussions with a group full of great minds. So it's been a really good balance of the things that I look for in practice and in learning to be a doctor.